170 over 100. Your chest tightens. You feel dizzy. You grab your car keys, thinking you need to get to the ER right now. But hold on. What if I told you that moment of panic, it might not have been necessary at all? You see, this exact situation happens to thousands of seniors every single day. And most of them aren't having a heart attack. They're just caught in a mistake no one ever taught them to avoid. I'm Dr. James, and today I want to give you the truth behind those scary blood pressure numbers. I'll walk you through the most common mistakes I see patients make at home. I'll show you when to stay calm, when to act fast, and most importantly, how one small habit in your daily routine might be quietly damaging your heart without you even realizing it. If you're over 60 and you want to stay strong, independent, and avoid unnecessary medication or hospital visits, this is the video you need to see. So, take a breath. Stay with me. And if you haven't already, go ahead and hit that subscribe button, because what you're about to learn could save you stress, money, and possibly even your life. Let me ask you something. Have you ever thought, I feel fine, so my heart must be fine too? It's a comforting thought, and for years, many of my senior patients believed exactly that. No dizziness, no chest pain, no reason to worry, right? But here's the hard truth. High blood pressure doesn't always knock on the door with symptoms. In fact, it's often called the silent killer for a reason. It can damage your arteries, overwork your heart, and increase your risk of stroke, all while you feel completely normal. Imagine your heart as a water pump and your arteries as garden hoses. If the pressure inside the hose is too high for too long, tiny cracks begin to form. The hose might look fine on the outside, but inside, damage is building. That's exactly what happens with high blood pressure over time, and if you don't measure it the right way, you might not catch it until it's too late. I once had a patient, Linda, a 66-year-old retired teacher. She came in for a routine visit, smiling, telling me how great she felt. But when we checked her blood pressure, it read 172 over 98. She was shocked. She'd never felt anything wrong. We dug deeper. At home, she'd only measured her blood pressure once a month, sometimes after her morning coffee or while chatting with her daughter on the phone. The readings had always bounced around, and she assumed that was just normal for someone her age. The truth is, her heart had been working overtime for years, and because she felt fine, she never thought to question it. That's why understanding how and when to check your blood pressure is so important, because the damage doesn't wait until you feel something. It builds quietly, day by day. And the good news, once you catch it, you can start making small changes that make a big difference. In the next section, I'm going to show you 5 of the most common mistakes I see seniors make when checking their blood pressure at home. Mistakes that can lead to false readings, unnecessary panic, or even the wrong medication. But first, think about this. When was the last time you measured your blood pressure the right way? 2. The 5 most common mistakes when checking blood pressure. Let's talk about what often goes wrong and why your blood pressure monitor might be lying to you without you even realizing it. Over the years, I've watched many well-meaning seniors follow all the advice their doctors gave them. They buy a home monitor, they check regularly, and yet their numbers are all over the place. High one day, low the next. It's confusing, stressful, and often leads to fear or even unnecessary medication. And most of the time, it comes down to this. They weren't taught how to measure correctly. Here's what I mean. Just last month, I had a patient, George, 71 years old. He came in clutching his notebook of blood pressure readings, looking worried. The numbers were sky high. 178 over 95, 164 over 100, even a few over 180. He was convinced he needed to double his medication, so I asked him how he was checking at home. He told me he usually did it while sitting in his recliner, watching the news, with his legs crossed and his arm resting on the armrest. Sometimes he'd even talk to his wife while the cuff was inflating. We took a moment in the office to show him the correct way. I had him sit in a chair with his back supported, both feet flat on the ground. We placed his arm on a table at heart level, with the cuff on his bare upper arm, not over a shirt. We waited 5 minutes in silence before measuring. His blood pressure dropped from 178/95 to 132/78. Same person, same heart, but a completely different reading. That's how powerful proper technique can be. You see, even small things, like talking, being tense, or having your arm too low, can raise your reading by 10, 20, sometimes even 30 points. And if you're making 2 or 3 of those mistakes at once, it's no wonder the numbers seem scary. So here's what I tell all my patients. Always measure your blood pressure when you're calm, sitting upright, not talking, and haven't had caffeine, alcohol, or even a meal in the last 30 minutes. Rest for at least 5 quiet minutes before you begin. And once you pick an arm, usually the non-dominant one, stick with it every time for consistency. The goal isn't to chase perfect numbers, it's to see the truth and avoid unnecessary fear. Now that you know how easy it is to get a false reading, let's move on to something even more important: knowing when a high number is actually a red flag and when it's just a temporary blip. In the next section, I'll explain exactly when it's time to stay calm and when it's time to take action. But before we go there, let me ask you this. Have you ever measured your blood pressure and seen a number that scared you, only to find out later that it was just stress or timing? If so, you're not alone. Let's make sure next time you know exactly what to do. Now that you understand how easily blood pressure readings can be distorted, the next question is critical. When should you actually worry? Because let's be honest, sometimes the numbers do mean something, and knowing when to act could be the difference between staying safe at home and preventing a life-threatening event. Here's what I tell all of my patients. A single high reading, even if it's scary like 160/100, doesn't always mean you're in danger. It depends on the context. Were you stressed? Just had coffee? In pain? Talking while the cuff inflated? All of these can temporarily raise your numbers, but there is one moment when I want you to stop everything and seek help immediately. That's when your blood pressure shoots above 180 systolic or 120 diastolic, and it's accompanied by symptoms. I'm talking about chest pain, sudden shortness of breath, severe headache, blurry vision, confusion, or weakness in your face or limbs, especially on just one side of the body. These aren't just numbers anymore. These are signs that your heart, brain, or kidneys might be under attack. And in that moment, waiting or guessing is not the right choice. You go right away. Let me tell you about a man named Alan. He was 68, recently retired, healthy by most accounts. One afternoon, he checked his blood pressure. It read 162/90. He panicked. But here's the thing, he had just come in from the garden, was sweating, and had downed a cup of coffee minutes earlier. He rushed to the emergency room, heart pounding from anxiety. By the time nurses saw him, his blood pressure had dropped to 128/80. They ran tests. Everything came back normal. Alan didn't need emergency care. What he needed was information and reassurance. So here's what I recommend. If your blood pressure is elevated, but you feel okay, no pain, no dizziness, no strange symptoms, sit down, rest quietly for 5 to 10 minutes, and check it again. You might be surprised how much it changes. And if it drops, that's your sign it was temporary. No need to panic. But if the numbers stay extremely high and you're feeling unwell, that's your signal to take it seriously. In that case, don't wait. Don't second guess. Go in. Knowing the difference between a false alarm and a real emergency can save your peace of mind and, sometimes, your life. In the next part of this video, we're going to shift from numbers to something even sneakier. It's a habit almost every senior I know has. It feels harmless. But day by day, it may be quietly wrecking your arteries from the inside. We'll talk about that next. Let me take a moment to shift your attention away from numbers and toward something even more dangerous. It's not stress, it's not genetics, it's not your age, it's something you probably use today, maybe more than once. It hides in your kitchen cabinet, and it's quietly sabotaging your blood vessels even when you think you're eating healthy. I'm talking about sodium, but not the kind you shake onto your food. The real culprit? Hidden salt, buried inside everyday items you'd never expect. Let me tell you about Margaret. She's 68, a widow, a grandmother of 3, and a wonderful cook. She came to me frustrated. Her blood pressure was climbing steadily, despite walking every day, eating home-cooked meals, and avoiding the salt shaker. So I asked her what she typically cooked with. She smiled and said, "Just some soup every morning, a little flavor cube, nothing fancy." That one little flavor cube, it had over 2,300 milligrams of sodium. That's her entire daily limit, in just a few spoonfuls of broth. And that was before she added any cheese, deli meats, bread, or salad dressing. She was trying her best and still getting hurt. This is the part most people miss. It's not just what you add to your food, it's what's already hiding inside it. Packaged soups, canned vegetables, frozen dinners, even healthy sauces and salad dressings can be loaded with salt. It doesn't always taste salty, but your arteries can feel it. Sodium makes your body hold on to more fluid. That extra volume pushes against your artery walls, making your heart work harder. Over time, this leads to stiff vessels, high pressure, and increased risk of stroke and heart failure, even if you feel fine today. Now, I'm not saying you need to eliminate salt completely. Your body needs some sodium to function, but most seniors are getting 2 or even 3 times what they need without ever touching a salt shaker. So, what can you do? Start small, read labels, avoid items with more than 140 milligrams of sodium per serving. Try flavoring your meals with garlic, lemon, fresh herbs, or vinegar instead of salt-heavy powders or sauces. And if you use flavor cubes or broth packets, try cutting them in half or switching to low-sodium options. That one change, just 1 teaspoon less of hidden sodium per day, could lower your blood pressure and reduce your risk of a heart event by up to 30%. That's not hype, that's data, and it starts with awareness. So, take a look in your pantry. What's hiding in your food right now? In the next section, we'll shift from what to avoid to what you can do every single day to strengthen your heart, calm your arteries, and lower your numbers naturally, without fear and without extremes. Now that we've uncovered the hidden danger in your pantry, let's talk about something far more empowering, what you can do, starting today, to protect your heart. Because the truth is, blood pressure isn't just about what you remove, it's also about what you consistently add to your life. One of the most powerful steps, adding more leafy greens to your plate. Vegetables like spinach, arugula, kale, and Swiss chard are packed with natural nitrates. When you eat them, your body turns those nitrates into nitric oxide, a compound that helps relax your blood vessels and improve circulation. A simple bowl of steamed greens each day can make a measurable difference. Another quiet hero is garlic. Whether you add it fresh to your meals or take it as a supplement, garlic contains compounds that improve blood flow and lower inflammation. I've had many patients lower their numbers over time just by making it a regular part of their week. Then there's movement. Not intense workouts or gym memberships, just walking. Even 10 to 15 minutes a day, especially after meals, helps your body use insulin better, lowers stress, and keeps your arteries flexible. Let me share a quick story. David, a 73-year-old former mechanic, once told me he hated exercise, said it wasn't for him, but after one appointment, I simply challenged him to walk around the block each morning before coffee. 2 weeks later, he doubled his route. Within 3 months, his blood pressure dropped from 145/92 to 122/78. Same medications, same diet, just 1 walk a day. Sleep matters too. Poor sleep, or inconsistent sleep, can push your blood pressure higher overnight and keep it elevated through the day. So choose a bedtime, keep it regular, and give your body the rest it needs to heal. And finally, there's something incredibly simple and completely free that I encourage all my patients to try. Deep breathing. Just 5 minutes a day. Inhale through your nose for 4 seconds. Hold for 4. Exhale slowly through your mouth for 6. Do that for a few rounds while sitting quietly. You'll feel your shoulders drop, your pulse slow, your body returning to calm. It's not just relaxing, it literally activates your parasympathetic nervous system, which helps reduce blood pressure naturally. None of these habits require big changes or expensive tools, but together they build strength, they build stability, and they build resilience. So let me ask you, what's one habit you can start today? Maybe it's adding spinach to your lunch, maybe it's swapping out that broth cube, or maybe it's just a walk first thing tomorrow morning. Whatever it is, write it down, make it yours, because every quiet, steady choice adds up. Now, before we wrap up, I want to leave you with a final thought and a gentle challenge in our closing section. You don't have to fear your blood pressure. You just need to understand it, measure it with care, and make one small, steady change at a time. Because even if you're 60, 70, or beyond, your heart is still listening, and it's never too late to start protecting it, gently, wisely, and consistently. So here's my challenge to you. In the comments below, share one thing you're going to do starting today. Maybe it's 5 minutes of deep breathing. Maybe it's checking your labels. Maybe it's simply resting before you take a reading. And if this video helped you feel calmer, clearer, or more confident, I hope you'll click like and subscribe, because your health deserves clarity, not confusion, and your future deserves your full strength. Stay strong, stay steady, and I'll see you in the next video.